Hey everyone, good evening, welcome. Hope all of you are able to see my screen and hope all of you can hear me. Can I have a quick confirmation, guys? Everyone, can I have a confirmation, please? Can you hear me? Perfect. Thanks, Omsi. Thanks for confirming. Okay. Uh, we have started with our concomitant medication. That's what we have started discussing from yesterday. Now, before I start with the remaining variables, because we have started with the discussion also, right? So before I started with the remaining variables, I just want to understand few things from you, right? Because what exactly this concomitant medication is doing? I said that it is going to talk about, or it is going to capture the data of concomitant and prior medication or therapies used by the subject. Simply, can I say like this? Concomitant medication is the one apart from anything other than the study drug, anything other than your study treatment. Can I call that as a concomitant medication? Yes or no? Simply, we just want to understand this in a clear way. We have a study drug, which is what we are getting. We are going through the multiple phases. That is what your clinical trials is. Correct? So either a medicine or a equipment or a treatment, which is under the clinical trials, is called as a study drug or study treatment. If you take any medicine other than this, is going to be concomitant. As simple as that. Yesterday, while we start our discussion, I told that there is a slight confusion may rise between clinical events, adverse events, and medical events. Correct? What clinical events will do talk about? What are the events that are happened because of the symptoms or side effects? What is your adverse event will talk about? All the events that are happened because of your some unforeseen events, anything which is not expected. Correct? What is your medical history is all about? Patient past history. Correct? What are the various what is going to be his condition? Does he having any asthma, or does the particular person met with an accident? All those. Correct? Remember how to differentiate these if I want to talk about it. Your adverse event talk about what happened. All these three are events. All these three are events. Okay, if they discuss about what happened to the patient. So patient had Covaxin or Covishield, so he got vaccinated. That is your study drug. As a result of that, what are the side effects that are occurred? Let's say the patient, because of this particular vaccine, patient got fever. Only that will be recorded here. Remember, the topic variable is important. The topic variable is CA term. The topic variable here is EAA term. The topic variable here is MH term. They will talk about what is the event that happened. Correct? So the event here is fever. Correct? The clinical event happened here is fever. For the fever, what happened? What is the medicine the patient is taken? That will not capture here. That will be captured under your concomitant medicine. The patient has taken a Dolo 650 mg tablet. Dolo 650 mg tablet has taken. Orally, he has taken the pill. Okay. Why he has taken that? Because of the side effect of your vaccine. Where it get recorded? Under the clinical event. Now, can you differentiate your CM and CE? CE is a clinical event. It will talk about the clinical event here. Because of the clinical event or because of the event that has occurred, right? What is the medicine that or what is the treatment that patient or subject is undergone will be recorded under here. Yeah. That is the reason here the Focus variable, that is your topic variable, is going to be CMTRT, treatment. It will talk about the treatment. It will talk about the event. The same thing is with the adverse event also. All of a sudden, patient felt vomiting sensation. Vomiting sensation is not because of your Covishield vaccination that he has taken. It is not the symptom of that. It is not the side effect of your vaccine. But this vomiting sensation, all of a sudden, the patient is feeling. It's an adverse event. So the adverse event is vomit. What is the medicine that is taken? Again, will comes under your CM treatment. Again, the patient is having asthma. For asthma, what is asthma? Is the medical history. This patient is having asthma. So before coming to the clinical event, before he come into the clinical trials, he is having some medicine. In the clinical trials, he is taking that. Even after the clinical trials, the subject is going to take this particular medicine. So what is that medicine we will talk here? The medicine or the drug or the therapy or the treatment, whatever is happening here, what is the dosage of that? What is going to be the frequency of that? All these things will be part of your concomitant medication. Is that clear to everyone? Yesterday I told to you by end of this particular class I'm going to give you clarity about what is the difference between all. Anyone, any questions? Is this understandable now? How do you differentiate your events and your concomitant medications? Can I have a quick confirmation? Anyone, any questions or doubts? Feel free to ask me. All right, no one is responding, so I'll be under assumption that it is clear. Okay, perfect. Now, so let's start with our discussion again. So what is our discussion? We were talking about concomitant medication. So we started with it is going to capture the prior medication therapies or concomitant medicine that is taken by the subject. Most of these details will be present in your case report form. The nature is going to be one record per recorded intervention occurrence or constant dosing interval per subject. You can see that once we started with our examples. The topic variable is going to be concomitant medicine treatment. Identifier variables are study ID, domain, use subject ID, sequence number, group ID, and sponsor defined or what is that? Sponsor defined identifier. Correct? So now you can see that first three I don't need to explain. We have done this multiple times. Study identifier, which is present in your protocol, as well as your annotated CRF. Domain is going to be a 2-character abbreviation, which is CM. Unique subject identifier is going to be, it is a combination of your study ID, site ID, and subject ID. You're going to concatenate them. Sequence number at a patient level, that is at each subject level, you're going to define it within your domain. That is at a subject level, it should be unique within the domain. Group ID, we can tie group of related records together. All the people who are taking aspirin, all the people who are taking dolo, all the people who are taking some other medicine which is related there, right? So we can give a tag to them. That is nothing but your group ID. Sponsor defined identifier is nothing but it is defined by your sponsor. It is going to be printed in your CRF or it is going to be maintaining by your sponsor's operational database. CMTRT is your treatment variable, sorry, your topic variable. It is going to define what is the name of the drug or the medicine or therapy that subject is under, right? It is going to be collected as is. Whatever is present in your ACRF, as it is, you are going to write it. We are not going to make any changes there. The next one is going to be CM modified for the CM modified. This is going to be your modified term for your CM treatment. Only for the coding purpose we are going to change this particular. Sorry, some mouse misfunctioning. All right. CMD code, it is going to be a dictionary, a standard medication name. Remember, it is not a MEDDRA, it is not MedDRA. Here it is going to be a World Health Organization. Whatever your WHO defined, the same thing will come to the picture. If it is not defined in your WHO database, then it is left as blank. Then CMCAT is going to be your medication or treatment category. What category it falls under? Suppose if it is going to be an anti-cancer medication, then you are going to have a subcategory that is nothing but your chemotherapy, or it is going to be your hormonal therapy or alternative therapies. All this comes under your subcategory. Your pre-specified CMPRESP is nothing but your pre-specified concomitant medication. The control terminology is going to be yes or no. It is defined in your CRF. CM occur, which is nothing but the occurrence of your concomitant medication. Again, it is going to have a control terminology, yes and no. CM start stands for what is the status, whether it is done or not. How we are going to define it. During the screening, you are going to note down all the details about. So whatever the questions you have about your concomitant medication, has the patient clarified or not? Has the patient answered or not? If all the questions were answered, it is going to be yes. If not, it is going to be no. Suppose if it is not, if it is N, that is the status is not done, it is not complete. In that particular case, you also need to give the reason for that. What is the reason why it is not done? Reason for not done. That can be stored under your CM RASND, which is nothing but reason not done. INDC stands for your indication. That is nothing but why the patient has taken that particular drug. Right? I told you, like vomiting. For the vomiting, he has taken it. For the hypertension, he has taken it. So why the patient has taken this particular drug will be under CMINDC indication. CM class, that is medication class, the respective code will be under medication class code. CM dose, the dose is nothing but what is the amount of medicine the patient has taken. The detailed description will be under dose description. That is dose TXT is going to be complete details of that. Dose units, that is nothing but either it can be in milligrams or nanograms or milligrams per kg or ml. All these fluid ounces, all this becomes under your dose units. Dose form, what kind of form it is, whether it is a tablet or it is an injection or it is going to be a lotion, what kind of form it is, that is your dose form. So then we started discussing about the dose frequency, and there we have stopped the class. Correct? That is what we did yesterday. So till this, any of you have any questions? Kindly ask me.
Sir, I have one question.
All right. Sorry, is someone speaking? I can see some disturbance, but I couldn't hear anything. Is someone
Yeah,
speaking?
yes, I have one
Uh,
doubt. Here we are capturing the concomitant medication details for which event we are taking, whether it is adverse event or medical history or clinical event we are taking this drug. Is there any
okay.
provision to identify that?
No, we don't have any provision. So simply, okay, that is what I have started discussing at the start of this class. So generally, we don't record because of what event the patient is taking this particular medicine. We don't record that. Okay. But what we record is anything other than the study drug if the patient is taking, that is what your concomitant medication is. That can be because of adverse event, that can be because of clinical event, that can be because of medical history. Right? We don't record because of what event or because of what history the patient is taking this medicine. We don't record that. Is that clear? Manimar.
Yes, yes, yes.
Yeah. And we also need to understand one thing. This is for our understanding. Generally, anything study drug, we know because that is what we are actually testing or we are performing the trial. So study drug is pretty much clear because it is part of your DM, arm code, arm treatment and all. Anything other than the study drug if patient is taking, we need to know why. So there are only two possibilities. Either the patient or the subject has past history. One is the past history, let's say BP. BP blood pressure will be there for the patient before coming to the clinical trials itself. So to control that particular one, the patient is having some pills. So here the case is going to be past history. This adverse event and clinical event, recently only we split this. We means the CDISC. Before or other than medical history, anything will fall under your adverse event only. Anything. Later we got a split. The split is going to be, if it is a symptom or side effect, it is going to be a clinical event. Other than the symptom or side effect, any other, which is unforeseen, we don't know what it is. So those will be comes under the adverse event. Ideally speaking, only two chances, either past medical history or your adverse event. Now adverse events again subclassified into clinical events. That is the reason you are having two different domains. Correct or not? Other than that, we don't expect anything, right? We are testing a drug. This is part of your demographic domain. Patient already has some medical history, so medical history will have the details, what drug it is taking other than the study drug. Other than the medical history, other than the study drug, anything that is happening because of the adverse event. If the adverse event is serious, now it will go to AE. Adverse event is mild, adverse event is because of the side effects, it will go to the clinical. So internally, we need to have this particular character. But in the domain, we don't have a provision, we don't have a variable which will record this particular details. Any other questions on this? Wonderful, very good question. All right. So CM occur means repeated using a drug, yes or no? Okay. The occur repeated CM occur means patient was using this particular drug before. Let's say, how I can go with this. Let me take one of the medical history. Patient was having some migraine, right? So migraine is the one the patient was experiencing or the patient was suffering from in the past. For that, the patient has taken some medicine. He already taken the medicine, right? Over a period of time, he have taken two different medicines. One, to get relief from your the migraine, he has taken the medicine. At the same time, to prevent migraine. So we have the prevention tablets also for the migraine, right? So to prevent also he has taken it. Okay. Now what is going to happen? The concomitant occurrence, the CM occurrence or medical occurrence for the migraine now is MH occur is known. He has taken this particular medicine before, but he won't take now because it got controlled. Right? Let's say there is another patient. He is also having the migration relief tablets at the same time prevention tablets because it is not controlled yet. He is taking the course. This course will have, let's say, the 2 months of the time. After 1 week of taking the prevention medicine, he entered into the clinical trials. So what is going to happen now? For the next 5 weeks, the patient continue to have this particular medicine, right? In this, my occurrence is going to be yes. Priyanka, is that clear? How do you note down or how do you identify your occurrence? Questions. Feel free if you have any follow-up question on this. Wonderful. Anyone? Any other questions? Manamaran, do you have any follow-up question on this? All right. Perfect. Okay, let me proceed then. Now, let's talk about the dose frequency. So dose frequency, it is pretty much clear with what frequency we are taking this particular medicine, as simple as that. But we need to understand what are the various dose frequency standards we have, or the control terminology we have, all right, or the examples that we have. So here are a few of the examples. I just have noted down here for easy reference. Here it is. Perfect. Sure. So we have some of the details here. Let me talk about these details. So the first one is BID, or you can also call it as BD, which is nothing but twice a day you are taking this particular one, right? Twice per day or 2 times per day. Okay, let's go with the easy terms. PRN. PRN generally used for collapsed one. Collapse, that is, there are two ways of representing the data. Yesterday I shown that to you from your what is that, implementation guide. Let's say one person, one subject, for an example, maybe I can write it here. So 111 is the subject ID. He is taking aspirin tablet, which is going to be 100 mg. 100 is the this one dosage, and the mg is the units. Every day he is taking. The frequency is once daily. So your start date is going to be, let's say, 25th from the past one week. 25th May 2022, he has taken it. The same day is going to be the end date also, right? Per day, only once in a day he is taking it. So 25/5/2020. The same guy every day taking this medicine every day. So 25th followed by, he has taken this particular medicine on 26th. He has taken this on 27, 28, 29, 30th, and 31st till today. Every day this guy is taking the same dosage and with the same interval, constant interval. So how many records are there? Totally 7 records. 7 days he has taken this particular one. So here I just defined this as, let's say, once. Maybe I can also do one thing. Let me change this to maybe 21, 21st, 22nd, 23rd. After that, 3 days gap. 24th, 25th, 26th, 27th, 4 days he haven't taken the medicine. Again, he has taken this particular medicine from 28th to 31st. This is how it has done, right? But the dosage is going to be, the dose frequency is going to be once in a day only. Though we have it between these days, 4 days, even though the subject haven't taken any medicine, the frequency still is going to be once in a day, right? There is another subject. So here the sponsor decided that the subject is going to be 222, same medicine, same dosage, but from the 21st to till today, the patient also taken the same medicine, same interval. First 3 days he have taken, then he have given the gap of 4 days, again 3 days he has taken. But here I want to mention this as PRN. I don't want to go in detail. I simply want to mention PRN. The PRN here is nothing but as needed. As needed. When I don't want to give the detailed information, when I want to give the collapsed data like this, then I prefer to go with PRN. So who will decide this? The sponsor itself will decide. Is this clear, guys? One, we are going to use the PRN. Can I have a quick confirmation? Right? The next one is going to be QD. QD is nothing but daily. It can be per day or daily. Both of them will be the same. Or you can also say that the rate of occurrence within a period of time equal to 1 day. Within 24 hours, if you are doing it with the interval of 24 hours, if you are doing it, still you can call it as a QD, or you can also call this as a once. Both of them are valid. Okay. Then QID, 4 times per day. It is 4 times per day. Let's say Dolo 650. Exactly. SOS. SOS is too serious, but still, yes, you can take it. Right. So what is this 4 times per day? Let's say Dolo 650. What is the general Dolo 650 range? It has to take it for every 6 hours. Correct? So it is going to be 4 times per day. QM every month, per month. It is going to be per month. Then QOD every other day. Q OD every other day, every second day, every 2 days. All these are going to be same. TID, thrice in a day. It is thrice in a day. Three times per day, or yeah, just written unnecessary. Unknown. We don't know the frequency. No one has recorded it. Then it is going to be unknown, right? Generally, we don't go with this particular one. Unknown will be highly no chance, I can say. Generally, whatever the medication that we are taking, we have the frequency of that. We have the frequency, right? So irregularly, let's say that once in a while the person is taking, in that particular case, you can go ahead with the unknown. Clear? All of you are clear with what is your dose frequency? Can I have a quick confirmation? A very easy one. So your all concomitant medication or your even the following topics like your substance, all these are going to be simple. But you need to understand what kind of data will flow there. That's it. All we need to care is what kind of data will flow there. That's all we need to understand. All right. Now, so this is dose frequency, right? Now, the next variable that we want to discuss is going to be CM. DOA stands for year dose. TOT. TOT stands for total daily dose, right? Total daily dose. Let's say I'm taking this particular medicine, Dolo 654 times a day. Each time it is 650 grams. How much it is? Totally 3,600. 2,600. Total is going to be 2,600 mg, right? So the total dosage of, if you want to write it in detail, the total dosage of your CMTRT, whatever your concomitant treatment it is, what is going to be the total dosage that we are going to write? Yeah, right. The next one is going to be CM dose. What is going to be a dose regimen, right? That is nothing but what is the schedule, right? Some medicines you need to take for, let's say, 1 week. After 1 week, you need to give a gap for another 1 week. Then you can proceed. Or you take the medicine for 2 weeks, right? Kind of a washout period, you can say, but washout period is not the right word here. But it is going to be like you take the medicine for 2 days. Sorry, you take the medicine for 1 week, then wait for 2 weeks. That is, don't take the medicine for 2 weeks. Again, go with the 1 week frequency. So continuously you take for 1 week, you wait, you don't take any medicine for 2 weeks, then again you can take it for the next one. So what is going to be a intended dose regimen? That will be regimen. The intended dose regimen is going to be a CM dose regimen. So what is going to be an intended dose regimen? Right, simple things only. We don't need to be what to say, complicate this, but try to understand in a examples that we are related. Okay, I can say that it is going to be 2 weeks on and 1 week off. So I'm taking this medicine for 2 weeks continuously, take 1 week off, again I can continue. All right, then CM route. This yesterday someone asked, when we are talking about this dose from the dosage form. So we talked about tablets, we talked about the lotions and all. There someone talks about orally, correct? But that will falls under your CM route. The CM route is nothing but route of administration. How you are taking this particular dose, right? The examples are going to be: are you taking them orally, or how you are taking them? What are the other things are there? Can I say intravenous, right? Directly to your vein system, right? All those are going to be how we are taking this particular medicine. Up to this is one set of variables. From now onwards, whatever the variables that we are going to discuss, most of them, not most of them, all of them will talk about your time or time duration. So the first variable here is going to be CM start date and time in character format. CM SDTC. What is that? Start date or time of your medication in character format. Am I correct? This is what we define it even in your what to say other things. So AESTDDC, DMSDT, all these are going to be the same. MHSTDDC, right? So what it is going to be the format? The format should be, it should be in a character format, and the acceptable formats are going to be ISO 8601 DA or DT. Correct? Either it is going to be a timestamp or only it is going to be the D. If it is a start one, then there is going to be an end date as well. So end date and time of your medication in the character format remains going to be the same. Can you see this? So the patient started taking this on daily basis. So here the start date and time as well as your end date and time remains going to be same. Correct? Yes or no? All right. Now the next one. So everywhere we are going to calculate some days. Correct? Maybe I can take it from here because we don't need to write it. We can simply copy paste this. Yes, here it is. So here you have adverse event start day and end day. Same thing you are going to have. CM. What is CM? Study day of start of medication. What is that? Study day of start of medication. What is the other one? Study day of end of medication. Right? Everywhere we are calculating this CM. So how you are going to do this? You are going, this is going to be a derived variable, and based on DM variable called, what is the DM variable? Reference start date and time, treatment start date and time. Here it is also going to be based on your, is also a derived variable, but based on the DM variable called treatment end date and time in the character format. Correct? So going to do the same here. CM, take this, right? Take this particular one. Then this is going to be this. This is going to be here. Clear? Right? The same calculation techniques that we are going to use right from the beginning. Right? So if it is going to be your concomitant medication started date time is prior to your reference start and date and time, then you are going to do minus and you are going to add 1. Else it's simply going to subtract it. The same logic is going to be applicable for the A. Right. So you have one more variable here. What is that? AE duration. Similarly, here I'm going to have CM duration. What is your CM duration is all about? Duration of your medicine. Here it is an event. Here it is going to be duration of your medicine. Remember, everywhere we are going to talk about this. It is not a derived variable. It is not a derived variable. It is purely, we are going to mention in the CRF, whatever is the mention in the CRF as it is, you are going to do it. Am I correct? So make sure it is going to be collected duration for a treatment episode. You can also call this as a collected duration of the, or I can say collected duration for a treatment episode. Right? It is not a derived one. We simply take this particular one from your CRF as it is. Okay, this is not the right thing here. So CM duration. What else is pending? So still we have 6 more variables. These 6 more variables are going to be relative variables. These are going to be relative variables. So what are those relative variables? The first one, CM STRF. It talks about start relative to the reference period. Start relative to the reference period. This you need to recapture it. This you need to recollect it from your adverse events, or you can do it from your medical history. You can do it from your clinical events also. All right. So what exactly it is? It describes the start of the medication relative to sponsor defined relative period. Right? Sponsor already going to define some reference period, right? With that particular reference period, what is this relation? Start relative to the sponsor defined reference periods. Okay, so how it is going to be? How it is going to be? Generally, the examples are going to be, it can be a prior to the sponsor defined one, or it will be ongoing, or it is going to be continuing. Am I correct or not, guys? The same thing, whatever we have defined in your AE, the same thing will come there. Here also we have this. In AE, you don't get STRF. In the medical history, you are going to get, right? So that's the reason this one I haven't copied from the AE. But the remaining all we can do it. The remaining all we can take. All right. Now we are going to take your end reference point, that is end reference to your end relative reference to your sponsor defined one. Take this particular one here. I simply call it as a CMENRF. Everything remains going to be the same. Here also the examples are going to be pretty much same. Correct? So then you have your start reference, start relative to the reference period, end relative to the reference period. Both of them we have given here, right? This also maybe I can copy paste here. Timing describes to the start of the medicine relative to the sponsor defined one. It's not the event, it is going to be the medicine, right? So now we have the start reference point as well as the end reference point. Now you're going to talk about reference time point, correct? Start relative to reference time point, end relative to reference time point. Okay, so those two also part of this one. Let's take this particular one. Here you are going to have only end reference. So here we are going to talk about STR, start reference to the time point, but it is not AE, it is going to be SEM, right? So end relative to the reference time point. Timing identifies the start of the medicine as being before or after the reference point defined by a variable called CMPPT. That also we need to discuss now. Okay, so the control terminologies, same stuff we are going to discuss. You don't need to be this much elaborate. You can simply use this. Right. So this is start. The same thing I can also do it for the end reference. So here instead of ST, I'll go with end reference to the relative point. So here also it is going to be STR, STTPT. This is CNTPT. The one going to be the C. What are the two more variables that we need to decide? These two we need to discuss. What is going to be a start time point and what is going to be a end time point? Okay, that is C. Why I'm writing C? CM. This is also C. Okay, CM start point. So what I'm going to write it here? I can simply say that start reference time point. For the other one, these are all permissible variables on the right. 90% of the time we won't calculate. End reference to the time. Done. Am I correct or not? You don't have a calculation for this. These are going to be describes, right? Reference point refer to your previous one. Either it is going to be visit one or it is going to be some example, some date. Like this. Example. Let's say today's date. So the time point reference is going to be 31st, or we are going to write 2022 05 31st, or it can be my visit one. Right? The same example I can also do. On this. Clear, guys? These are the various examples, or sorry, these are the various variables that is part of your CM, right? So pretty much easy and straightforward. You really no need to worry about it, right? All you need to understand is what is the data that is here. Okay, so can we quickly look at some of the examples as well, right? So directly I'm going to take these particular examples, right, directly from your what is it, SDTM implementation. Directly I take it from here. I'll explain here, and later on I just prepare notes for it and I can do it. Okay, where it is. See. Right. So here you can see this is the example that we have taken yesterday also. So the first one here, we want to talk about the treatment is aspirin. See here, you can clearly see no way we are capturing whether this treatment aspirin the patient is taking because of the medical history, or the patient is taking because of the adverse event or the clinical event. We are least bothered about it. All we bothered is here, what is the who is going to be the subject and what is the treatment that is taken. So the treatment is going to be aspirin. Dosage is 100. Units are going to be milligrams. And here you can see that for the first patient, you can see the sequence is going to be 1, 2, 3, 4, 5, 6. 6 days he has taken the medicine. Every day it is going to be once, right? Then you have another patient, right? So he has taken this particular one for 2, I can say that for alternate 24 hours. That is for every 3 days once he has taken this. Then you have BID, 2 times a day the person has taken this. Correct? Sorry, I'm missing this. Just give me a second. Q24H I'm missing. I'll just give me a second. I'll come to this. And go with the last one. It's a collapsed one. You can see that the patient has taken this particular one from 1st to 9th as needed, which is PRA. I'll give you the details about Q24H. Don't worry. I'll give you that in a while. Then second one, you can see here, there are 2 things, right? So here we are talking about, we don't have any information about what is going to be the dosage or what is going to be the frequency. All these details we are not giving. Simply we are saying that there is going to be a patient. So subject 1 here is going to be subject 2. These 2 are 2 different patients. We simply has given lithium as well as VPA, right? We have not mentioned anything about what is the dosage information, right? Here we are not calculating, or we are not considering the efficacy of your drug. We are not considering your safety of the drug. That is, we totally understand that it is not related to your study drug efficacy as well as safety. So we are not mentioning this. Sponsor decided to go with by not providing this dosage information as well as dosage units information, and also your dosage. See, nothing here mentioned. Simply he has given the information about what is the treatment that he or she have provided. Right? This is called spontaneous concomitant medication. There is one more thing. Here you can see. Here also, this particular one, you can see the CM occurrence is the one that you need to understand, right? So you can see that here the occurrence is yes, here the occurrence is going to be no. Both of them are pre-specified only. All the three medicines are pre-specified only, right? But the first one, the occurrence is yes. For the second one, occurrence is no. Both of them will be mentioned in your CRF. But if you see the last one for this particular guy, the CM occurrence details are not given. That's the reason you can see the status is going to be not done. When the status is not done, immediately you are going to see what is the reason for this. Didn't ask due to interruption. Whoever doing the screening, that particular person haven't asked the details about the occurrence. So the status is not done because all the questions were not answered. At the same time, we are providing the reason for that. Make sense, all of you? Right? Simple and straightforward. So these details I'm going to provide it to you. Anyways, I'm going to give the examples. Don't worry about it. I'll do this by today. Sometime today, I'm going to share the notes as well as the examples to you. Any questions on this? Priyanka, I saw your message. I hope I replied to you as well, but I don't know whether after that have you tried or not. So don't use your SAS Studio, which is coming as part of your installation. Don't do that, right? Because the formatting issues are coming there, the encoding issues are coming there. Instead, go with your SAS Studio, which is present in your SAS.com, which is present in the SAS. Oh, you tried it and you got it. Wonderful, wonderful. Because this one, you don't have any issues. You go to this, it is most advanced one, and SAS is providing this. It is a cloud-based solution, and it is really one, right? No pirated versions, nothing. It is for SAS for the academics, because SAS stopped the enterprise, that is university edition, and it started encouraging people to use this one, SAS Studio, right? Use this particular. Anyone, whoever having any of the encoding issues or formatting issues, please try to use it. All right. Any questions from anyone? So what we're going to discuss tomorrow then? We will go with exposure, exposure as collected. Both of them we will do tomorrow. Not both of them, only one will be done. It is also a little, what to say, more variables will be there, 20 to 24 variables will be there. So these two are the targets for tomorrow and then. So once I complete this particular one, then we can go ahead with the substance use. That is the next one. I will go as per this, guys. I think you all know that. So we'll go with the substance use. There it is. A lot of examples. Okay. Procedures we don't discuss. Substance use we will go with, right? This one we are going to discuss. So this is a small domain. So once we complete this particular one, we will be good with the interventions. So this one. Exposure as collected, that we need to discuss tomorrow and day after. And concomitant medication, that is done already. Substance uses we will do. So tomorrow and day after tomorrow we will go with these two, and then we will go with the DM coding. So we will be comfortable with 8 domains, and we will be comfortable with theoretical part. Interventions also completed. Then we will go with the practice. Laboratory will take a lot of time. Lot of variables will be there. But once you understand this, the mining things will be easy. Cool. Perfect, guys. So SDTM will take a lot of time because I can see other institutes or someone else. I don't want to comment, but still I want to go with that. They will cover special purpose domain. From there, one domain from each of the category they will do. But I don't want to do that. I want to go completely all the domains I want to touch. So I'm just going in this flow. Okay. If anyone says that no, Murli, I'm okay with that. So from here on, let's say go with the laboratory, remaining we will be, go with one of the trial domain, remaining we will be. Then let me know quickly. I can finish and I can get the add-ons. So ball is in your court. How do you want me to proceed? I'll go in there. All right. You can also comment that in our WhatsApp chat. I'm okay with that. So I'll share this particular details to you. So after that, we can discuss further on. Okay. All right, then. That's all for today, guys. Any questions, feel free to ask me. If you don't have questions, we can wind up the session. Okay. See you tomorrow, guys. Bye.